Thank you, Senator. Good afternoon, members. Thank you for having us here. We know it's been a long afternoon. I'm less than 3 minutes, so bear with me. My name is Miryam Bujanda. I represent Methodist Healthcare Ministries. We're not-for-profit. We're faith-based. We provide primary care for the uninsured in 1/3 of the Texas counties. We are guided by the social principles of the United Methodist Church, and we believe healthcare is a basic human right. We also believe in partnerships between public, nonprofit, and government. And we are here today very proud to share with you the report we commissioned on Medicaid extension entitled Smart, Affordable, and Fair by Billy Hamilton Consulting. The goal of the report, Senator Dole and members, is really to continue the dialogue that it's my understanding you've all had, and we've had conversations with some of you regarding the Medicaid extension. And it's to continue that dialogue as it relates to economic impact analysis as a smart way to spend via the Medicaid extension. There's 1.4 million Texans that would qualify at the minimum level for the Medicaid extension. As you know, it's funded for 3 years at 100%, and then continues dropping until it reaches 90%, so that Texas would pay 10% as the most amount. And with the concerns you mentioned, Senator Dole, as you heard, Arizona and New Mexico have been able to negotiate with the federal government for that expansion, with the understanding that when the federal government dropped their 90% match, that state would then drop that program as well at that match rate. The first 4 years investment for Texas is $3.7 billion, and that would give us a drawdown of $27.5 billion. Those dollars circulating within Texas boost our economy to the rate of $67.9 billion, according to our Hamilton report. We finally believe, like you do, to keep Texas thriving economically. And to do that, we think that can be done with the Medicaid extension. It will create 703,000 jobs in the first 4 years. It saves 28,500 lives, potentially. And again, that is through early detection and treatment. MHM is here to be at your service, meet with you and discuss the report, and look at a way to find better ways for Texas. Thank you for your time.
Dr. Buell, well, I'm not going to reiterate the previous arguments and everything, but if we expanded Medicaid and if the federal government withdrew their support, then you would be in support of us dropping the expansion?
Yes, sir. We think if that's what the legislature wants to do, and if that's how they feel they need to come in and try it, if you will, you know, what I usually do in public education is talk about the idea, as you hear, you know, the Mikey commercial. Try it, you'll like it. If you don't, get out. Well, I think that's what we've got here in Texas. We're saying try it. If it works for us, if it helps us in the economy and we like it, we stay. If it's not doing well for Texas, then we get out.